Good morning, everyone. How's everyone doing this morning? Very good. Well, welcome to this AAEM workshop. I'm very excited to be here, and it's a privilege and honor to be speaking to all of you today. Just to get a sense of what my audience is like today, I was just wondering how many people in this room are physicians, MD or DO? How many people in this room are dentists? Oh, great, welcome. And then, how many of you in this room are very new to environmental medicine, practicing only within 1 to 5 years of environmental medicine? Oh, great, welcome. So the intent of my lecture is to provide you with a basic overview. It's not really meant for you to understand every single fundamental concept, but it's an overview. So AAEM offers instructional courses for any one of you in this room who wants to be certified and become fellowship trained in AAEM. So I encourage you, if you're interested, if you're not fellowship trained, to take a look at all our other instructional courses. So before I start too, I just want to mention that I don't have any financial relationship with any companies in my talk or offering any monies for this continuing dental or medical education program. So I've completed a family practice residency and a 3-year fellowship in environmental medicine. And I had the honor and privilege to work with Dr. Bill Ray and many of my mentors in this room who've taught me the fundamentals of environmental medicine, which I'm including into this talk. So again, I don't have any financial disclosures. And so one of the basic core concepts of environmental medicine is the total load. We accumulate a variety of different load for our environment, from the outdoor air, from the water that we drink, the food that we eat, and all our other exposures. So there are many exposures that we have in the home that many of us may not even think of as a toxicant exposure. A lot of people have like air fresheners in their home, which they think smell really nice, but they can be very damaging and have neurological effects for a very young child. And so this is just a great illustration of a variety of different things that can be found in the home that can have a great influence on one's health. Sometimes my role as an environmental medicine doctor is I find basic, because a lot of the information that we find from patients is essentially in the history. Finding out a good history, what patients are exposed to, helps you really identify what the core issues are with your patients. One of the other things I'm going to point out in this picture is that, and of course I pushed the wrong button, is dry cleaning. A lot of individuals will dry clean their clothes, bring them home, put them in their closet. And formaldehyde is one of the things that we find as a huge toxicant exposure in a lot of individuals. Cigarette smoke still remains as one of the most toxic indoor air pollution that people are still exposed to this day. This table illustrates systems that are affected by various toxicant exposures, like people who live next to a vinyl chloride factory, individuals who live near that have a higher incidence of liver cancer, individuals who have exposures to lead and cadmium have higher incidence of kidney issues. There's a lot of toxicant exposures like lead, tobacco smoke, that can contribute to cardiovascular disease. We have other workshops that teach us how to mobilize these toxicant exposures. And some of the IV treatments that we use for patients help to utilize nutrients that help to mobilize and help the body to excrete some of these toxicant exposures. One of the core basic concepts of environmental medicine, like I mentioned, is the total body burden, total load. So each one of us has a certain capacity to handle a toxicant load. So over time, as we get older, we typically are exposed to more things in our environment, and our capacity or our cup or rain barrel ability to handle our toxicant load gets overfilled as we get older. So an individual who is younger can start off at the age of 3 with asthma or allergies, and then over time that can be masqueraded and become food intolerance, chemical sensitivities. And then as they get older, they can have hormone disruption, chronic viral or mold infections, and it accentuates, and at the very end of environmental illness, we find people are very sensitive to EMF, and they become very hypersensitive to their environment around them. So you can have a toxicant exposure, become sensitive to that initial insult, and then over time become sensitive to things that are similar, and then become sensitive to things that are unlike your initial toxicant exposure. Typically, people will exhibit immunotoxicity first, then we'll have neurological issues, and in the end stage of environmental illness, also have endocrine illness. So what that looks like, as I mentioned earlier, is asthma and allergies in the beginning. Neurological issues can result as like a simple tremor or brain fog. And then endocrine issues at the end stage can be like feeling hot or cold and having thyroid dysfunction or hormonal dysfunction. There are some individuals who present to me, they're in their 50s, they feel like they're female, postmenopausal, and they come in feeling that maybe it's hormone related. And sometimes, after doing a thorough history, it may not be hormone, it could be some type of toxicant exposure. Dr. Quigg has talked about a case that he's had of a woman who is drinking a box wine and accumulated over time this lead exposure. So in the box wine. So we have to do this in a very thorough environmental history to understand what our patient's toxicant load is and what their exposures are. I find that this is a good illustration to talk about the body burden and environmental exposure. So, like I mentioned, every one of us has an ability to handle our toxicant load, but each one of us genetically have a different capacity and ability to handle our toxicant load. So some people are born with a shot glass size of ability to handle their toxicant load, and some people are just born with this rain barrel size with a greater ability to handle their toxicant load. So for children who are born on with a shot glass size of a toxicant load, they're born into this world, and some of these children have maternal fetal transference of the toxicants pass from the mom to the baby, and so when they're born, their shot glass size of their toxicant load's already half full. And then, they get into this world, they're exposed to the indoor pollution, and then perhaps get some vaccines, and then their toxicant load starts to overfill, and that's when we start seeing symptom and disease states occurring. So it depends on the individual's genetic capacity, and later on today in subsequent lectures, Steve Ottersberg and Andre Usman is going to talk about how do we assess this genetic capacity to handle a toxicant burden, and how do we understand individuals' their inborn genetic error. And so we can use genetic testing just to give us some insight to how to tailor an individual treatment protocol for patients. And so they're moving on to how do we detoxify. There are 5 organs of detoxification. I'm going to move through this a little bit quickly. So the skin is our largest organ of detoxification. That's why we use some sauna therapy to help mobilize toxicants that are stored in the fat. One of the things that I always want to highlight and mention when we do like infrared saunas or any type of mobilization using sauna therapy or heat therapy is you want to use a glycerin soap after, because that will help to bind the toxicants that are being excreted in the skin, so then it doesn't get reabsorbed again. So in this part of my lecture, I put the organ and then some of the techniques that we could use to help detoxify. The respiratory is one area where we can breathe in good air and having good breathing technique is really important for oxygen exchange. Aerobic exercise is really good for individuals. The kidneys is another way that we detoxify and excrete out toxicants. It helps to filter out waste products. And in general, we usually say patients to drink like 8 cups or 8 glasses of 8 ounces of water a day to help to mobilize and detoxify. We know that just anecdotally that if we put some lemon water in patients' drinks in the morning, that helps to alkalinize them, and pH balance is extremely important. The lymphatics is another area of detoxification and mobilization. So generally we would use like homeopathic drainage remedies to help patients to mobilize and detoxify. Regular lymphatic massage can also help with a lymphatic movement. The colon is another area where we want to encourage elimination. So patients who are constipated tend to be more toxic in general because they have this hepatic recirculation of toxicants in their body. So we want to ensure that patients have a daily bowel movement every single day. If not, we want to encourage that with fiber intake and have patients limit their amount of processed foods they're consuming. And for some individuals, we may want to use colon hydrotherapy or coffee enemas to help encourage this type of elimination. The liver, as we know, is our body's main organ of detoxification. And so the liver handles a lot. So there are 3 phases in liver detoxification. We call it biotransformation. So there's phase 1, which when the liver encounters a toxicant, it makes a chemical change where the toxicant can be a little bit more toxic to the individual because of the metabolite that is formed. In phase 2, the toxicant is conjugated and it makes it more water soluble, so that the intent is that we're trying to mobilize this toxicant out of the body and make it more water soluble. Phase 3 is through the colon. Okay. So in general, when we do our liver cleansing goals, we want to reduce the body's circulating levels of toxicants. And we primarily like to do that with diet, because the number 1 principle in environmental medicine is remove the exposure. So again, that's why in the next couple of slides I'm going to highlight how to look through a physical exam and patient evaluation. So the couple of these slides I'm just going to go through and you guys can read through it. This is some general detox drinks. It's very generalized. It's things that we've acquired through various different lectures at AAEM. I've included it here that you can start to utilize for your patients. Okay. So I like to like I mentioned, talking about certain foods that enhance detoxification. So the phthalate groups, garlic, onions, cruciferous vegetables, they have this ability to bind certain toxicants. There are a variety of different research that have looked at various foods to help mobilize certain toxicants. Artichoke, beets, burdock, and naturopathically, these are the foods that we've known historically to help kind of support patients through their detoxification. A lot of patients, when you do their history, they don't eat a lot of different foods, and you tell them to avoid gluten, soy, corn, and a variety of different foods. They are always saying, what am I left to eat? And so I always like to give patients, this a handout that I made that have included a variety of different colored foods. So I ask patients to eat one of these different foods and in their diet a day, because some people may only eat carrots or peas or just corn as their vegetable, and they're not incorporating a lot of other different vegetables in their diet. And another thing too is water consumption for a patient. A lot of people are consuming a lot of coffee or tea and not drinking adequate amounts of water to help with detoxification. another essential general detoxification strategy is sleep, to assess your patient's sleep strategy. A lot of us are using our devices before we go to bed, and what I'm mentioning to patients now is that it's probably best that we put our devices down. The blue light from our computers and our phone are detrimental to our sleep pattern. We often are always in a rush, so patients are always eating on the go and on the run. So I ask patients to take some time, sit down to eat their meal, to have adequate digestion, because that's an essential core and key to one's health. Another thing is when they sit down to eat slowly and chew thoroughly, and to take the time to really meditate on their eating rather than rushing or doing multitasking. And for me too, like no electronics before bed is really hard for myself and for my patients. A lot of my patients just balk at that and ignore it. But for those who do implement it, they do find that they have better sleep patterns, and then in general, feel better overall. And so a lot of the things that we're encountering today and the things that we see in our patients are a result of our lifestyle. And so it's a matter of understanding your patient's lifestyle, understanding their nutrient status, and putting that together and coming up with an individualized plan for your patient, whatever works best for them. So these are some general detoxification dietary guidelines. Of course, I just have to emphasize it, but I'm sure everyone in this room knows, eating an organic diet is important. If you're not aware of the Environmental Working Group page, this is a great resource for your patients to download this handout, and so they can take it to their grocery store and help shop for the top, dirty dozen that have the highest level of pesticide residues. So we want to encourage organic foods as much as possible. And an anti-inflammatory diet. So my next part of my lecture is the patient evaluation. And again, I think this is where we get our information. There isn't any better laboratory test that can give you the information than your patient themselves. So I'm going to go over and highlight the key elements of this part of my presentation. If anyone is interested in using validated testing or validated neurological testing, this is a good resource that you can download. And which is really great about this website, they have different computerized assessments that your patients can do online, and it is reimbursable by insurance with certain CPT codes. And so you just contact the company and they can walk you through that if you're interested in incorporating validated testing. So in general, when you're doing a patient evaluation, of course, looking at the patient's general appearance. I think for a lot of doctors who are from the conventional aspect of medicine, when they do the 5-minute visits, tend to overlook the patient's physical appearance. So that's something that is very important for us not to disregard. So understanding what the patient's appearance looks like, what their hair look like. What we tend to find in environmental medicine is patients who have early signs of alopecia, are some women who work in the nail salons, or people who work in high levels of toxicant exposures tend to have a higher level of persistent organic pollutants and tend to have a greater hair loss. So how we explain this is that, these toxicants compete for certain nutrients in our body, and these toxicants will bind to certain enzymes and make it non-functional. So some of the nutrients that are needed for hair growth are the same nutrients that our body are trying to utilize to help to excrete these toxicants out. We mentioned earlier that the skin is our major organ of detoxification. So if we're not able to excrete it out through our bowel movements, our body tries to eliminate into another way. If it can't get it out through the kidneys, which is another way, then the body also tries to mobilize these toxicants through the skin. Certain environmental exposures that are connected to skin health, like contact dermatitis with nickel exposure through like watches. Arsenic, over time, if somebody is consuming a lot of like non-organic chicken and happens to accumulate arsenic and they can't mobilize that well, the arsenic can deposit into the skin, so you'll see white spots on their skin. Mercury is another toxin exposure that we can gain, because a lot of women who want to whiten their skin will use white lightening skin cream, and a lot of these creams have mercury in them, and so you'll find these products overseas, and some patients will come in, and when you look at their products that they are using, will have a lot of toxicant chemicals and that shouldn't be applied to the skin at all. So that's something that you would have to look at too. And laundry detergent are one of the things that are common, that a lot of individuals will find that certain laundry detergents will not work for them, even though they're considered organic and natural. So we have to ask about, a lot of things in the patient's life that could be affecting their health. So this is what an arsenic toxicant exposure is over time. Like I mentioned, the arsenic can deposit into skin and cause this these white spots on the skin. This is an extreme example of organochlorines affecting skin health. This individual was poisoned at a dinner, and the next couple of days his skin had this appearance, and it wasn't until a toxicologist who saw him on the news knew what this exposure was due to, and it's dioxin exposure. So we have low levels of dioxin exposure in our life, even though dioxin is no longer it's been banned in the United States, but we use dioxin around the world, and then we import things into this country, and of course people do travel too. So we're getting these exposures that the half-life of dioxin is 20 plus years. This is stored in our fat tissue, and so we may not be seeing acute levels like dioxin exposure, but we are seeing patients who have this low level accumulation of dioxin exposure. So if you have patients who have, abnormal skin presentation, and you've tried everything and haven't come up with anything, one of the things that we tend to look at is we can measure these dioxin exposures and other pesticide residues that can contribute to bad skin in individuals. So this is just another illustration of all the different consequences of dioxin on the body. And so you can see the drastic difference on the skin of this individual. Persistent PCBs is another chronic low-level toxic exposure that we're seeing. Again, this is a byproduct of industrial pollution, and yet we are still seeing people across, in different countries, but also here because we import a lot of food in, and so some people may have this type of chloroacne, is what we describe it. This is a case of an individual in Taiwan when they had the rice bran oil that was contaminated with PCB. So a lot of individuals develop severe consequences to their health because of this exposure. Vitiligo is another common environmental, skin exposure that we see that kind of gets overlooked. We know that patients with vitiligo, for the patients that I see, and it's been documented in the literature too, that there's a connection with mercury and vitiligo. So patients who may be consuming a lot of fish with high level mercury content fish, like tuna and the big fishes, they may be accumulating a high level of mercury that their body can't excrete out. And so over time, if you're not able to excrete it out, we store the mercury in and deposit into the skin. And so this is just some illustrations of what vitiligo could look like. And I mentioned that in the literature, people have looked at this, they've seen this connection of mercury and vitiligo, and I pulled this, and I just want to highlight this. study where it mentions mercury levels in vitiligo patients, where the study concludes that there's no connection with mercury and vitiligo because they measure the blood levels of patients. And so what we do know about toxic metals is that the metals don't stay around in our circulation. So the body doesn't know what to do with the metals, so it tries to excrete it out or it gets stored. So the key thing from this is that patients may have a toxicant burden of metal that's stored in their tissue, and for the dentists out there, if a patient's getting their amalgams removed or they had amalgam put in their mouth, oftentimes we're not going to see a serum blood level of mercury because that's what's representing what's in the circulation and not what is stored. So in other courses that we have, we talk about how do we mobilize and test for this toxicant exposure and toxicant level of mercury. The nails is one of the areas in which, I think it's overlooked too. The nails can tell us a lot, from lead exposure to arsenic exposure, thallium exposure. We know patients with different presentations in their nails can have zinc deficiency or selenium deficiency. And why that's the connection, kind of like with the hair connection, is that selenium and zinc are these nutrients that the body needs to mobilize to help with detoxification. So the body is utilizing the nutrient stores to help mobilize, and so it leads to this deficiency that gets presented in the nails. These are other nail presentations. And for cadmium toxicity and zinc deficiency, or cadmium, you see these little white spots. So that's pretty common. Looking at an individual's eyes, the conjunctiva, is it clear? In Chinese medicine, we say that the liver kind of opens up to the eyes, and so it can really tell us a lot about one's health. Is there conjunctival and injection? And we can assess liver health through that too. Ears, we know that if we look at the tympanic membrane, we can assess to see if there's any congestion or postnasal drip. And a lot of patients kind of overlook the fact that they have this postnasal drip that they had all their life, which could be attributed to some type of toxicant or environment inhalant allergy. So, looking at a patient's nose to see if it's boggy, and it surprises me that a lot of times patients have this boggy presentation in their nose and they don't really have any idea or relation to what could be contributing to it, and it becomes their new normal. So a lot of patients are walking around with this new normal of they adapt to their environment and they no longer think that it's an issue. So we see that a lot of our patients with allergic rhinitis, or some people are allergic to cats, or every season, when ragweed season comes around, they'll know they'll have some type of allergic presentation. And so for those individuals, we know that they have some type of immune dysfunction. And if under stress or any other issue comes up in their life, that can cascade them into this environmental illness, becoming more brain fog and then endocrine dysfunction. So it kind of starts with immune dysfunction in the beginning. Another key concept in environmental illness is nasal fatigue. So an individual who walks into a room, let's say it's newly painted, you walk into the room, you smell the paint, and then after 60 seconds, you no longer smell it anymore. And even though you're not smelling the paint after 60 seconds, you're still inhaling the fumes of the paint that can still be adversely affecting your health, but you may not no longer make that connection that it is contributing to ill health. And so some people with mold exposure, mold in their home, may no longer recognize that they have an issue in their home because they've kind of acclimated to the mold smell in their home. I mentioned air pollution. Indoor air is a huge issue because some people just keep their windows and doors closed at all time, and they don't get any good air circulation in the home. These are some contributors to indoor air pollution, shoes, like walking from outside to inside, slow burning candles that have the fragrance in it and the leaded wick. A lot of cleaning products that we use have solvents that are, some products are banned, but some people still use them in the home, or they purchase it from out of the country and bring it back. Then go through the mouth. If we look at someone's teeth, the dentists in the room know that each of the teeth correlates with a certain organ function, and so decay or infection in certain teeth can affect other body parts. I used to work in Arizona with a dentist, and we always collaborated together with our patients, and then he would taught me the dental charts, and it was really interesting to find that there's, like, for patients with breast cancer, really have an infection in that tooth, and it's become very common for me to look at patients who have certain teeth issues, or people will say, well, I've always had pain in this tooth, and then I send them to the dentist, and it really correlates and corresponds to their adverse health effects, and so I found that to be really interesting. Mercury, we know that dental amalgams can be a huge issue, and I don't have to go into great detail for anyone in this group, but we do know that there's certain testing that we could use to identify what replacement we could use instead of mercury, and the dentists in the room can teach that to me. But what we find is sometimes patients will get their mercury amalgams out and then get replaced with composites that have high levels of BPA. We know that BPA has reproductive issues and other health consequences, like connected with cancer too. This is a study I just pulled for an individual who had high levels of lead, circulating blood lead, and acute toxicity of lead. And when you have these high levels of lead, you see what we call Burton lines, these black and blue lines in the gingival area. We're not seeing acute lead poisoning anymore, but we are seeing chronic low level of accumulation of lead in our patients. And as many of you may be aware, we have issues with lead in our water supply in various different parts of the country, and that still remains a problem. And so it's really important for us to understand the distinction for chronic acute exposure and patients who have this accumulation over time. So lead and calcium have this relationship with each other, and lead will be stored into the bone if it's not excreted out through the body. So looking at the neck, lymph nodes is really important to evaluate and palpate, because again, a lot of people overlook that they have cervical lymph congestion. I mentioned cardiovascular earlier. Mercury and cadmium can affect your cardiovascular health. Some of you may be aware of the TAP trials that looked and evaluate the use of chelation therapy for heart health. And there's TAC2 underway now. And what's interesting about this study is that the TAC2 is looking at patients with diabetes, and we're also looking at toxicant levels of metals in that study too, which is really interesting and exciting. I mentioned earlier people who are exposed, who live near factories that produce vinyl chloride, have a higher incidence of liver cancer. I'm going to just kind of highlight and skip through some of these slides. And musculoskeletal issues, one of the things that we can highlight here is that patients with chronic cadmium exposure can have early signs of osteopenia or osteoporosis. This is the osteomalacia, is a severe end-stage exposure to cadmium. What we're seeing now in our patients, because we have a lot of EMF around us with higher use of Wi-Fi in our environment. We have, Wi-Fi disguised as palm trees in Southern California. And so a lot of patients are being affected by EMFs, and they may not know it. There was a case I had of a child, 10 years old. He came to see me, and he started developing seizures. And he came because he wanted hyperbaric therapy. And so in my evaluation and history, what we found is that his seizures started when they moved into this house that was previously owned by an electrician who was doing his own electrician work in the house and rewired the house improperly. And so it led to this this electrical pollution in the home. And so I mentioned it after coming home from one of these conferences to the patient's parents. And they had their home evaluated by an EMF specialist, and sure enough, the EMF in the home was through the roof, and they had it remediated, and this child stopped having seizures. And so the parents were also really reluctant to having the child start on anti-seizure medications. And that was the other reason why they came to see me. And so with that remedy and fix, this child did not need to go on any anti-seizure medication. We corrected the issue, and the issue was this high level of electrical pollution in the home. And I'm seeing more and more of that in the home, and in patients who are affected by EMFs. Some individuals can't have a cell phone near them. Once they have a cell phone near them, they can feel tingling in their hands. We have patients who have diabetes, who are severely affected by the EMFs in their home, and a PhD scientist, Magda Havas, she talks about that, and she has done a lot of research on the connection of EMFs into one's health. So I encourage you to look at that if you're not familiar with how EMFs can affect our health. Yeah. Oh, this picture? Okay, so I put that in there because I've given this lecture before. And so this picture was, it's this EMF device that they put on babies when they're born in the hospital so people don't steal the baby. So when my nephew was born, they put this little Wi-Fi device on him so they can track him throughout the hospital. So I just thought that was a little over the top. So when I asked why did my nephew have this Wi-Fi device on him, and he's less than 24 hours old. They're like, well, because, we want to track the baby and make sure that no one's stealing the baby. Which, you're in the hospital, you're around, a lot of nurses, but I guess it's an issue. So all babies who are born in the hospitals in Orange County, California, where I'm from, they all have, when they're born, they are placed with a Wi-Fi device so they can track them through the hospital. And so there's this security device. And that's another thing too, is that, we don't really understand the consequences of this high usage of Wi-Fi in our environments. So, sitting is the new tobacco, Wi-Fi is also the new tobacco, because we don't really understand. And there's a lot of litigation surrounding the use of Wi-Fi. So I put that in there. And then the meters in the home is also an issue. So there's a woman who I acquired this practice. And this woman who was in the practice previously, she, when the neighborhood in my community started putting this smart meter, so in different communities, they're placing smart meters in the home, so it's higher, better efficiency. When they put the smart meter in her home is when she started having ill effects to her health. So her hair started falling out, memory loss. She had a greater effect to mercury in her. She had high levels of mercury, but the health effects of that were more enhanced. So it took several years for the previous doctor to identify that perhaps it's the smart meter that was placed in her home that was contributing to her ill health effects. So once they uncovered that history, understanding your patient's environmental history is really important. So when did you get sick? When were you last well? And, that was the kind of the thing that was out of the ordinary. Okay, well, the smart meter was placed. And so what she was able to do was get the electrical company to replace the meter with the analog meter. And then also she was able to convince 7 neighbors down her street and both ways, up and down, to remove their smart meter. And that drastically improved her health. From just removing the smart meter. And we see that, and I always question, if someone has, so a lot of times patients come to me and they've seen many different providers before, and we tend to see each other's failures. So if another great doctor who hasn't been able to identify what the patient's core underlying root cause is, that's one of the things I look at first is what is their EMF exposure. So finding somebody who's well-trained, there's a certification program that these evaluators, kind of like a mold person, has to go through that's very unique. And so I have these people go, the patient contacts these people to evaluate their home, and they spend 2 or 3 hours at the home evaluating everything, measuring the patient's environment.
Most people don't even know they have smart meters on their home.
Correct. Yes, so that's another issue too. I currently have a woman in my practice. She had seen a couple of other providers in my community who I can highly respect. And she came to me because I'm an environmental medicine doctor. And what we found in her home is that her home sat on the grid. There's some, it's like a geo spot that her home sat on. And so in the morning, when people turned on their air conditioning in the morning before they go to work, like at 7 in the morning is when she would get really sick. And then at 4 o'clock when people started coming home, she would get really dizzy and sick. So after identifying that, she sold her home, and then, knowing that it had these issues. But what she later found out, or communicated to me that she thought was interesting, is when they bought their home from this woman who they thought was completely crazy. She painted each of the rooms in the house a different color. Like one room was purple, one room was pink, and she had these neurological issues. And this patient was saying she felt like she was becoming that woman too. So, and she's young. This woman that I'm treating is early 30s. But has really lost her life due to this contribution. And it's not the only contribution that led to her illness. So this is a woman who is a PhD student, driving to UCLA, and then driving all around town, and she was teaching classes at the community colleges, overburdened, very stressed out. So we know stress causes this immune dysfunction. So it's the combination of this immune dysfunction plus her total load and her total exposure. So it's, the diet, like she was eating on the run. She wasn't taking time for herself. And so those are the things that gets overlooked oftentimes. And so, we tend to start with the basics first, diet, lifestyle. And so for someone who that gets overlooked, their end level of environmental illness is this EMF toxicity and sensitivity. Bill Ray talks, when I was at his clinic, he talks about patients who, when they're in the clinic, they can feel the airplane fly over their head because they can feel, they're that sensitive, they can feel it. So that's something I think for us, we need to keep that in the back of our mind, and it's something that's coming up on the horizon for us to consider as a contributor to ill effects of health. I don't have to go into much detail about reproductive health, but we know that's a huge another issue that we have to be concerned about and be very cognizant to, because a lot of our children now are developing precocious puberty due to our environmental influence, greater use of plastic. So when I started my residency, it was a long time ago, back in 2006 or 2005, one of the first cases I had was this 7-year-old girl who had early onset of menses. She had breast buds, and 7, and I referred her to an endocrinologist, and the endocrinologist told me that was fine and it's normal. And so what we're seeing is that we're seeing more and more children with early puberty, and the endocrinologists are now shifting what was considered abnormal to now it being normal. So then I started working into these community clinics, and I was baffled because what I had learned in school maybe 3 years prior, that's when you send the patient to an endocrinologist, I was finding it was no longer a concern. So the endocrinologist balked at my referrals and just said it's fine. And so we know our contributor to early precocious puberty is through the use of plastics in our environment. For male reproduction, we're seeing young boys born with malformed genitalia, and we know that that's due to a couple of endocrine disruptors. Dr. Swan from University of Rochester published this, I consider, landmark study that measured the perineal distance in young boys and how that's changed over time, and correlated that with maternal circulating levels of phthalates. And this is something that isn't really talked about, but we're getting more awareness about. So that's why we have this greater push for us to be aware of BPAs and other plastic water bottle use. When, back in the day we used glass baby bottles, and then somewhere around the 80s they changed the way the plastic bottles were made, and in the 90s it became a little bit more flimsier, and we know that some moms would microwave plastic milk in the microwave. I even had a patient who I was explaining this to who admitted that's what she did for her child who is autistic, when he's 23 now. But at the time she's like, we didn't know, and it's not anyone's fault, it's just that we didn't know back then, and back then we were told it was safe. But now we're seeing the health consequences of what we did back in the late 80s and 90s. Now we're having this awareness that we should no longer be microwaving plastics. And there's some people who still aren't aware that we should not be microwaving plastic. I have this conversation with some of my patients. Surprisingly enough, like people who are on the go and on the run will purchase microwavable foods, and that microwavable tray has this thin lining of BPA coating in there too, so when you microwave it leaches into the food. There are a lot of studies now that demonstrate that BPA effect is contributing possibly to our increase of obesity in our population because of this higher use of plastics that we've had. So nail polish is one of the areas where in our environmental exposures that we see high use of phthalates. And so even for the cosmetic industry, they're taking awareness on this. And so there's some companies that are producing, phthalate-free nail polish and paraben-free products like hair products and care products. I put this up, and it's in your notes, the sexual maturity rating, just to have a framework of, the shifts that we're seeing in adolescent development. Because we're seeing more younger girls develop puberty, and then some boys who are more feminized. And in my fellowship training, I had the opportunity to work with Doris Rapp. And she had seen a lot of cases of individuals who, over her career, she believed that the high use of plastics and our environmental load and our toxicant load was contributing to this feminization of males and precocious puberty in young girls. And I think we're kind of seeing that in our population. And Doris Rapp had worked with a group of individuals. She, at the time, described it as, and she believed in it, it's that these kids who they called gender bending, and now it's more accepted that, people are, that's how they're born. But in Doris Rapp's history of being a pediatrician and as an environmental medicine doctor, she felt that was our pollution and everything that we're doing in our environment was contributing to this higher incidence of young boys who wanted to be at the age of 7, and so I had the opportunity to work with her on these cases, and that was like in 2006 and to 2010 I was working with her. So it was really interesting to see that back then, where we evaluate the mom's history, and that was why I was really interested in maternal fetal transference of toxicants, and that became an area of my research, which I don't have time to talk about in here, but we're just going to go through the rest of the slide set. Mentioned BPA. There are ways that we can measure BPA in our environments, but I think, again, like I mentioned, the treatment is avoidance. We can look at how much someone is exposed, but really we need to eliminate it from our usage. Neurological issues is something that we can assess when somebody walks into our office. We can look at the way they walk. Do they have any tremors? How is their speech? And so you can gain a lot by talking to an individual. There's a lot of studies that link pesticides with neurological issues. People who live near farms, who live near golf courses. One of the tests that you can do to evaluate someone's neurological function is to have them stand with their feet together and then close their eyes and then see if they sway and waver. There's a modified, I call it the modified Romberg's test, because that's the test that my mentor Walter Crinion used and Bill Ray uses in his office to evaluate a person's neurological function. And what that could be attributed to is patients with chemical sensitivities or other neurological issues that could be linked to like tick-borne illnesses, which I see a lot of. So kind of to summarize this talk, we are exposed to a lot of things in our environment, and it's these exposures that we have to look at. The patient evaluation is really important. Understanding a patient's their ability to handle their toxicant load, and Dr. Quigg's going to talk about how do you evaluate that through laboratory testing. And then Steve Ottersberg is going to talk, and Andrew will talk about how do you look at a person's genetics? Their genetics kind of sets the framework for their ability to handle their toxicant load. What is their size of their rain barrel or the size of their shot glass? How can we use that information to understand the nutrient status? Are there certain nutrients that the patient just needs more of in their diet? And then Dr. Quick will talk about biotransformation and how you can evaluate for that, looking at phase 1 and phase 2 detox, and really how to interpret the test results to come up with an individualized treatment plan. So I like to use this illustration in my talks because I found this to be useful when I taught at the college to medical students. I found it helpful to explain it in the beehive analogy, which is why you'll see beehives in my lectures. So the size of the beehive determines the patient's genetics. we can't really see how many bees are inside the beehive, but we can make an assessment looking at how many bees fly into the hive and how many bees fly out of the hive. So kind of looking at like a urine pre-test, or looking at what a patient is excreting out on their own with a first morning urine. That's kind of like looking what's kind of coming out of the beehive. And if I strike the beehive, it's kind of like using a binding agent to see, what is coming out. How am I assisting the mobilization of these toxicant metals? So I use this analogy when I talk about toxic metals and how do we mobilize and assess for body burden. The rest of the day, like I mentioned, we'll get into greater detail about how to assess for toxic body burden, how do we assess for detox pathways and our methylation pathways, and how to really utilize that. This is something that I want to highlight because oftentimes it gets confused. So when we're assessing for, I'm just using metals because it's easier to illustrate. So when we're looking at, say, metals, when we're looking at our hair metals look at what our body has been able to excrete out. It doesn't tell us what the current exposure is. So you'll read different research studies that say, the hair levels of children with autism have really low levels of mercury in their hair. Well, when we take a further step back and look at this study, it's that these children have an inability to excrete the metals, which is why they have lower levels of mercury in their hair rather than higher levels compared to their neurotypical counterparts. We know for hair analysis that methyl mercury is what is typically the type of mercury that is excreted out in the hair. So methyl mercury comes from fish consumption, not from amalgams. So the standard of care when we're looking at assessing for mercury is blood levels. So whole blood levels, and that's the royal top tube that you would use to draw the blood. And blood levels represent the recent ongoing exposure. It doesn't represent what already has been stored. Kind of like the illustration I showed you with patients with vitiligo who have a burden of mercury. That's stored metals, and patients with issues with like lead stored in their bone, that's stored rather than measured through the blood. So unprovoked urine is like a first morning urine collection that will show current exposure and what the metals are being excreted. And when we use a binding agent, we call it a post-provocation urine testing. We're seeing what the binding agent's able to pull out of the tissue, and we're measuring that. We're striking the beehive and seeing what metals are coming out. So this is a illustration of a test result of a patient with a blood mercury level of 18 micrograms per liter, and this is his post-provocated level of mercury. You're not always going to see a correlation. So some people, if you see no blood mercury, but you do a post-provocation test, you might see high levels like you see here. And there's some individuals who have a poor ability to methylate. And so in the beginning, what we found was that, we would do these tests and treatments, and we don't see anything come out on their post-provocation tests. And we come to learn that, well, if we understand their genetics and help them methylate, their ability to excrete will be much more improved. This is another case I had of a woman who her only issue was elevated liver enzymes, and no one else could find and identify what that was attributed to. And so you see her ALT was 42. It's not that terrible. But when we do a post-provocation test, this is a woman who ate fish every single day for breakfast. You see that her post-provocation level of mercury is 210. I think we had a blood level too somewhere. I had it somewhere, but this is just for an illustration and just to show you. Oh, okay, there it goes. So her blood mercury level is 14. So to illustrate, she high fish consumer, and then her total mercury spill was great here. So you can see that's what her body was storing. And then in terms of treatment, the intent of this lecture isn't to go over treatment, it's just to kind of give everyone an overview of toxicant levels and how it contributes to adverse health. So I'll just go over this pretty quickly. This is a patient I had who came in who was a father of a patient of mine. He traveled and he wanted to have this nutritional evaluation, and he came. He lives in Kenya, and they have high rates of infestation of parasites. So he was coming to see me really for parasites. But incidentally, on this test, I found that he had high levels of red blood cell mercury. So this doesn't look at acute toxicity. This is the intercellular functional analysis and what's stored. And what I found for him was, this is his whole blood mercury level, and you see it was 36. And this is his post-provocation level of mercury after testing. And so for this patient, I completely overlooked asking about metals because he came in looking just to be evaluated for parasites and gastrointestinal health. And what we identified, and I, because you get busy in practice and running your own business, I overlooked asking him about his diet. And so this individual is consuming like swordfish and really big fish. And so I put this as an example of, this is something I completely overlooked but was very obvious. And so the symptoms that he had come to me for that looked like it could be related to allergies and parasites was heavily connected to his high consumption of fish. And this is his levels. And so we treated him for that. And interestingly enough, after subsequent treatments, his allergies improved, his skin rashes improved. So, sometimes we always present our greatest success, but this was a success and kind of an overlook on my part in the very beginning. So I'm going to show you that. Dr. Quigg's going to talk about glutathione and how to measure. There's a couple ways we measure intercellularly, whole blood, and Dr. Quigg will talk about the differences between that and how to look at oxidative function. So I'm going to skip over this. Actually, I'm going to talk about this real quick because it gets overlooked. So I kind of highlighted mercury because it's the dental conference, and so I pulled these studies from different agencies that look at what is the defining level of toxicity of toxic mercury. So each agency has a different threshold of what they consider toxic, and that defines what we communicate as the safe level of mercury. So we know, like from the CDC, that there is no safe level of lead that we should be consuming. Yet we have, a level that we measure on the lab values that for lead, it shouldn't be higher than 20. That's when we think of treatments, or even for treatments for lead, some pediatricians and even the Academy of Pediatrics says that we shouldn't be treating patients for a lead burden unless their blood lead level is greater than 40. And same with mercury. So the issue with mercury too is that for women who are pregnant, we've now made this criteria that women should not have a blood mercury level greater than 3. But having a blood mercury level greater than 5 or 10 is, for other individuals, is considered okay. So these are the studies that they use to identify the critical dose or threshold. So we have 2 studies that look at that help policymakers define what the safe level is. So we have the Faroe Island study and the Seychelles Island study. So these two studies look at children with issues, and they look at the methylmercury found in the children and in the mom in both of the studies. And so from the Seychelles studies, they say that there's no harm to individuals with a circulating level of mercury because their neurological testing is fine. So the limitation of this study that I wanted to point out is that they translated the metric system from the Faroe Island to the Seychelles Island. So it's not exactly translatable. So that's one of the criticisms of the Seychelles studies. The interesting thing about the Faroe Island study is that the individuals who live in the Faroe Islands are those who also consume whale meat, which have higher levels of PCBs. So it's also the accumulation, the synergy of mercury and PCBs that I believe contribute to the differences into these studies. So just kind of giving you a little bit of insight onto how certain policies are made. Different agencies look at different studies and to make their own interpretation of what is considered safe. And so that's how they come up with, a blood mercury level of 3 is safe for pregnant women, when you really shouldn't be having any circulating levels of mercury. Because we know it's going to be transferred into the fetus. So I just wanted to highlight that because it doesn't always get talked about, and I found that to be interesting. So this is the overview of my talk, is really highlighting, looking at a person's toxicant exposure, and our goal is to drain the toxicant load from an individual. And sometimes, if the beehive analogy doesn't work, some of my students have liked using the bathtub analogy. So over time, with different exposures into your environment, you can clog up the bathtub drain, and that can slow down your ability to detoxify. And then over time, the bathtub gets overfilled, and you have to understand the input, turn off, the faucet, looking at different lifestyle contributors, understanding your patients. Exposures is really important. You get that from the patient's history. The history is really what leads you to understand what the next testing that you need to do. And that really kind of helps with your treatment plan for your patient. So I'm going to conclude here because the clinical nutrigenomics part, Steve Ottersberg is going to go into greater detail about that, how to assess, and then my notes kind of gives you a summary. So the individual SNPs are there and how it's related. It's in my notes in your handout, but Steve will go over really what it means and how to utilize it. And so before I conclude and walk off this stage, I wanted to show you a picture of an individual who I had treated when I was in my residency, and I might need visual audio help because I wasn't able to do this earlier. So just to give you a little bit background while that's being pulled up. So I saw this individual when he was 15 years old. He'd come to me, his mother brought him to me because the school decided to apply pesticides on the lawn in the playground. And after they had this pesticide application, this child had neurological issues, brain fog, depressed mood, and skin rashes that he had when he was younger started developing again. So this individual had seen Dr. Doris Rapp when he was a baby, which is really interesting because I, at that time, also happened to be working with her and she was mentoring me. And she had the same pictures that I'm going to show you of this individual. So I show you this case because it really highlights the maternal fetal transference, the genetic susceptibility of this individual. And so when he was born, or before he was born, his mother was a social worker. She'd gone into a home that had this pesticide application exposure. She got really sick, really nauseous. She was in her 3rd trimester. She went to the doctor. Thank you. She went to the doctor, and the doctor said everything was fine. This child was born with full body eczema and struggled with eczema throughout his life. Seen Dr. Rapp, and Doris Rapp desensitized him, provocation neutralization testing, nothing helped him. So what she did was Dr. Rapp said, the best thing for you is to move to Arizona. So, because back in those days, people from New York said move to Arizona because that was the place to move to because it was cleaner. The interesting thing is that when people moved from New York to Arizona, they brought their plants with them. So now Arizona isn't really considered that safe environment anymore. So this child, like I said, was born with full body eczema, and this is kind of what his skin looked like all his life. So the same pictures that this mother brought to me, Doris Rapp had in her garage, which is so funny because I was helping her clean the garage and I saw the same pictures, and she knew every single thing about this child and had all of this child's notes. So then the mom had some cleaning person come into the home and was exposed to Endus, a cleaning agent, and then his face was covered with eczema and was bleeding. And when I'd seen this mom and this child, she gave me permission to use these pictures and wanted me to use it in my education talk, so that's why I'm presenting it, to show you what this toxicant burden can do to an individual. So this is post-paint. So in the home, they painted the home, and then his skin got exacerbated by exposure to paint. And then after they moved to Arizona, because they were away from the inhalant exposure, this is the child less than 24 hours in Arizona. From their travel to Arizona, his skin cleared up. So this is just a clear example of removing the exposure. And because I was learning about genetics and genomic testing, the mom had asked me at the age of 15, can I test this child for his genetic susceptibility? So I did a test that I knew was available. At the time, 23andMe wasn't available. And this child didn't have any SNPs that were known to immobilize his detoxification ability. And the only thing that when he saw me that we did was I provided him with some liposomal glutathione, and then the rash that appeared from his exposure on the schoolyard playground, did the pesticide exposure, also cleared up in about 3 days using some liposomal glutathione. So I just present this as an illustration of someone who had this toxicant burden that was exposed to some chemicals when he was in utero, and then when he was born in the inhalant environment of in Buffalo, New York, and he moved to Arizona and his skin cleared up within 3 days. So I'm going to conclude with that, and then Dr. Quigg is going to now speak about how to utilize different testing, laboratory testing, to evaluate your patient.